Okay, we're recording. So welcome to week 3. Hopefully you're following along with your HESI study guide. Everybody has that, right? And if you're following week by week, then you should be, each boxes should be getting filled in each week, so it'll be easier for you to study for your HESI at the end, right? Everybody knows what I'm talking about, right?
Yes.
Okay. So this week 3 we'll cover at the end of today. That will be what's going to be on exam 1 next week. A couple things. One is I'm going to do my teammate, Dr. Kershaw, is gone from Wednesday for about 10 days. So I'll be covering her classes. So I'm going to set up, hopefully this afternoon, a couple of review sessions for your exam. I'm going to hopefully do one Friday and one Saturday. So I'd like to do one Friday to catch the group that works over the weekend, and then do one Saturday for the others. So hopefully that schedule will be out today.
Professor, I'm gonna go get some tea real quick. I'll be right back.
Sure, Walter. Sure. The other thing I'm working on is a study guide for exam 1 that covers the first 3 weeks. I know that you have 3 weeks of notes. I get that, but I'm going to try and summarize that for you in an organized way. So hopefully that will help. So review, and I should hopefully have that to you, I don't know, as soon as I can. I teach another class later on today, so I'll either be and first thing in the morning, so I'll try and work on it between classes. But anyway, so that's my plan. Do you guys have any questions about that? Would that be helpful? Everybody should be, everybody okay with books now? Everybody understand or have the right books? We should all have the right books and all the instructions for the right books, right? Okay. Let's go through. I'm going to share my screen. I'd like to go through this week's module. Okay. Okay. Well, let me go through the announcements because I posted quite a bit this week. Were you guys able to open your week 3 notes once I updated them? Apparently the first one I sent would not open. It was locked. Has anybody had a chance to open up their week 3 notes?
Yes, it worked.
It worked the second time. Okay, awesome. Okay, so hopefully you're pulling up your notes during lecture and taking notes on them. That would be a good way to organize your studying for exam 1. Did anybody have any questions about this week's what's due this week? Your NCLEX and your quiz number 2. And remember with your NCLEX to please go through, let's see, we're in week 3. So please go through this link. Okay, you got to go through the link on your module. Okay, to get to your NCLEX. A couple of people have already submitted it, but I did have somebody that submitted me a screenshot of their NCLEX, and I went through this in orientation week. It's a university policy. We can't accept screenshots. Okay, so it has to be an uploaded PDF. And so that's why it's important to go through your link from your module. Okay, so let's just go through today. We're going to be talking about specific vulnerable populations, in particular migrant farm workers, rural populations, homelessness and poverty. Okay. Your readings we'll get to. Your assignment was your first NCLEX, and then begin working on your vulnerable populations assignment. Okay. So let's get to
I
that.
have a question.
Sure.
Before, I think it was like last week or so, you kept saying something about getting groups together.
Yep.
The groups for this project.
Yeah, I think it's due, I believe, in week 7. Let me take a look. Yes, I'll get those groups to you in the next day or so. I had to get my groups ready for my RN class because their assignments due next week. So let's see. Group project right here. So it's due in week 7. Okay. And it's an infectious disease. So when I send out the groups, I'll send out the guidelines for the group project. Okay.
And the vulnerable populations project is just for us alone. We
Yep.
can start that on our own. Okay.
Yep. And that's due in week 10. So let's just review it thanks for asking that question. So here's what this assignment is about. You have to select a vulnerable population in your zip code. Okay, so in your community. Whether it's homelessness, teen pregnancy, substance abuse, it has to be in your community because it's like a research project. You have to pull up statistics and demographics and all of that. Okay, can you guys see my screen?
Yes.
Hello? Okay. So you're selecting a vulnerable population in your community. So don't submit a PowerPoint of like homelessness in the United States or homelessness or teen pregnancy statistics in the United States. This is specific to your zip code. And it says it right here. Conduct a windshield survey in your community. Everybody know what a windshield survey is? Kind of driving around, observing what's going on in your community. And here's the details. Windshield survey is completed by observing a population by looking out of the window of your car, bus, riding your bike to identify a vulnerable population in your community. So you're going to conduct research on your chosen population via the internet, by calling your local health department. I've even had students that are doing their homeless population go and interview homeless people. That's not required, but they have just gone beyond the rubric, which has been great. And then this project is a PowerPoint presentation. Okay, no, about 10 slides. Don't turn in 4 slides, just, go up to 8 or 10 slides, and you'll need it if you complete all of the details of it. All right. So we're going through this now. So you're completing your windshield survey. So there's several steps. Identify the vulnerable population in detail, identify health risks and needs of the vulnerable population. In the past, students have just taken these headers and taken these bullets and made them the headers on slides so that you don't skip anything. Okay. Identify resources that are available to those in need, those needed, and what's not available. Then this is important. Describe the service gaps in the interventions that could be used. So make sure that slide identifies primary, secondary, and tertiary interventions, okay, that could fill in gaps in resources. Then summarize. Okay, prepare a PowerPoint to communicate your observations and research. So this has to be, APA format, and here's how you should file name it right here. PRN 208, week 10, Kathy Marvel. Okay, and so here are vulnerable populations that we've given you. These are the most popular. Okay, if there's something else that you want to do, feel free to do it. Is there something else that you're interested in? Sure, in your community. And this has actually been a good tool or a good assignment for students because they learn much more about a specific.
Professor, I'm sorry. I already did something similar to this regarding the elderly population. And I did go to a facility and interview the staff and how the resources and all that. Is that similar to what you're talking about?
Yes. What class
Okay.
did you do that in?
I think it was gerontology.
Okay. I mean,
But
if you,
it was like similar to this. I did go around. I did put my, but I did go to a facility. I got in touch with the DON of the facility and CEO and all that stuff.
so
I got
just
a good
so just make
ex-
sure that all these are
is
identified.
covered.
Yeah.
Okay.
Yeah. Okay. And so here's the breakdown. Okay. So if I were you guys, I would just take each slide and use these headers. Okay. Population description. Make sure these 2 bullets are covered in that slide. What are the health risks? Answer the 2 questions in that slide. Kind of like this is kind of a template. Kind of like right? So use it as a template. Third one, what are the resources? And some of these, if there are a lot of resources, might take, up to 2 slides, right? What are the gaps? And here's your primary, secondary, and tertiary. Okay. So but look at the rubric. Okay. It's specific. It's specific to these topics above. Okay. So first is your population, which goes along with number 1. All right. So population, make sure you read the rubric. Right? Age ranges, ethnicities, employment status, and let's say you pick homeless. Make sure you add these in there. Okay, and look at the rubric. Health risks. The health risks of the population you included. So read the rubric. Okay, and then resources. To get the full amount of points, identify 8 to 10 resources. Okay, or 5 to 7 or less than 5. That's how this is graded. Okay. Service gaps, meaning resources, what would be helpful, resources that are not currently available, but would be valuable to improve outcomes of the population you discussed. Okay, and then again, APA format. So that's how that's graded. Okay, so everything's spelled out for you right here. And I pulled this up in week 10. So I think, so you'll have to go to week 10 because that's the week it's due. Oh no, actually this had it in here. Begin working on vulnerable populations. So just click on that link and it has everything we just went through. Okay. So thank you for mentioning that, whoever mentioned it. So this is an assignment that I would suggest that you don't start in week 9, okay, because it is going to take some legwork, some research that you need to do. Okay, so I don't know that you need to start it right away, right now, but certainly in the next couple of weeks, you should be identifying a population. And if you want to get going on it, absolutely get going on it.
Do you know how you're going to break us up in groups?
I usually do it randomly.
Because I know with this semester, like we have totally different schedules. So I don't know if it's going to be hard to do it with people that we don't go to the same campus with. So I was wondering, since a lot of us are from like what, 3 main campuses, if it could be broken up that way.
I could certainly do that. Yeah, I could certainly do that if it would make it easier for you guys. Yeah. The whole point of this is just to work in a group, because nursing is group work, group dynamics, teamwork, communication, collaboration, coordination. So yeah, I'm happy to happy to break you up in groups on the same campus if it's easier for you guys.
Thank
I
you.
agree with that. I think that's a good idea.
Yeah, I'm happy to do that. You bet. You bet. So your readings for week 3, where are they? I would have to go back to the syllabus real quick. Has anybody done any readings for week 3?
Regarding the migrant workers and
Yep.
stuff like that. Yeah.
Mhm. Okay. So we don't have any readings from the book, but we do have all these concept pages. Which we can review. I'm going to pull up the notes, and then we can also, we'll go through each of these concept sheets, and we'll talk about migrant farm workers, rural populations, homelessness, and poverty. We already went through NCLEX. Pardon me? Walter, what?
Oh no, sorry. Let me mute myself up.
Oh, no worries. And then you have quiz 2. Okay. And then let's look at next week. Okay, next week is exam week. All right. So what I will probably be doing, a lot of times I like to cover the exam week on the following week, but looking at weeks 4 and 5, I think it's too much information. And so I will probably do a recording of week 4 material and send that out to you. How does that sound?
That sounds good.
Okay. Pardon me?
Sounds good.
Okay. I hope to be, let's finish this. Case study. You have a case study next week. Okay. So that's already preloaded into your module. Just do the case study through the link in your module. Okay. Do not go into Evolve, or do not do it that way. Okay. And then we have our exam, which obviously is during lecture, right? So I'm hoping to set up the exam for you guys to download probably Thursday or Friday. And you just have to make sure it's downloaded before you come to class Monday afternoon. Okay, and I sent an announcement with all the guidelines. I'm sure you've read it a million times, but all the guidelines for having it downloaded before you come to class, check your internet. You know, I would check your ExamSoft account between now and next Monday, make sure it's still active, make sure it's still working, all that, so we don't run into any technical problems for you. And then please come just a little bit early so we can get you checked in. I start my exams at 5 after, right? So this is a 3 o'clock class, so I'll be starting the exam at 3:05. So you got to get here on time. Anything after 3:05, it's not my rule, but you have to go in the waiting room and we'll chat about what's going on, what, you know, and try and find another time for an exam. But if you're not here by 3:05, then when you eventually do take the exam, it will be a 10% deduction. So please get here on time, please.
I just have a question with that too. I'm pretty sure a couple of us have a class before this.
Oh, that's right.
So
yeah, that's right.
It would probably, I'm sure we can try our best to get here before then.
I see.
But we
Okay.
also have a test in that class too.
Okay.
But I just
Okay.
want to let you know, because I think it's majority of us.
Yep. Good point. Okay, so just come. Well, usually you're not taking I don't know if the PEDS instructor keeps you after the exam. I don't. I let you guys go. So I'm not sure what she does, but I would just come as soon as you're done with PEDS. And I will make a
Okay.
note of that. Thank you very much for mentioning that. I already have coming from PEDS for this class. So Anyway, okay, thank you, thank you. You're welcome, you're welcome. The one thing I want to do real quick from last week is review the quiz. Okay, I want to review the quiz because as a group, you guys did okay. Okay, so I want to make sure because that was week 2, well, kind of week 1 and 2 material. Okay, so let's go into the quiz. And let's go through it to make sure you guys understand. So I plan on going through the quizzes the following week after it was due. Okay, just to understand. You guys know what you got wrong, correct?
No, it doesn't show
No,
us.
it doesn't-
Only
it
shows
doesn't
us our
show.
score.
Only
Yeah.
your total score. Okay,
Yeah,
well,
you
let's
don't-
go through the 10 questions because I don't want to pull up somebody's quiz and show everybody what you got. But that's okay. So you guys don't know what you got wrong, huh?
No, we don't.
it just shows you the score, and I guess you
Right.
just
Mhm.
Yep, just the score.
Okay. Okay. Thanks. So let's just go through this. All right. So you guys, just anybody can speak. If you would just tell us the answer and why that's the answer.
I chose A
Okay. Because
it's the community based is more of like prevention, and I looked for the keyword prevention in there, and that was the one,
okay.
if
And
that makes sense.
Kind of. Anybody else want to take a stab at that?
I chose B, the educating a child and school teacher on the use of the inhaler, because I
Why?
was thrown off because to me pretty much all of them besides the last one was like the last one was a definite rule out, but the teen pregnancy, I remember talking about that, and then the vaccination, that was going to be my first choice, but I remember you got to educate, and the whole evaluating part of that one threw me off because I was like, I don't think you evaluate. I know you initiate, like giving them vaccinations and stuff like that, but I don't think you evaluate the outcome of that.
Okay. So what's the difference between community-oriented nursing and community-based nursing? So go ahead.
Community-based is you already in the community taking care of the sick. And the oriented is you basically in the community and you're trying to find out what you can do to make it better
As a whole.
as a whole.
As a whole. So you're looking at the community to see what is the health status, what could be healthy outcomes, what could be, you're looking at the community as a whole. That's correct, Chandra. So community-based is you're already working with issues in the community. You're based in the community. So knowing that, what would be the correct answer here? Well, think about it. The first one.
I think
Is-
it's the
B.
first one, because you already, it says nursing practice, you're already practicing, so developing a teen pregnancy prevention program will be one. I think that's the one.
Anybody have a different one? Different.
I think it's B.
Okay, the answer is B. Okay, and here's why. Developing a teen pregnancy prevention program would be community-oriented nursing, right? Because you're looking at the community as a whole. Evaluating the outcomes of a community vaccination program. That's also community-oriented nursing because this is geared towards looking at the community as a whole. Okay, same with D. Okay, providing diabetes education prior to hospital discharge. Okay, the correct answer is B, educating a child and school teacher on the use of inhaler, because you're based in the community, you're probably a school nurse, okay? And so you're teaching the child and the school teacher on the use of an inhaler. That's community-based nursing. Okay, let's go to number 2. What describes the purpose of Healthy People 2030 campaign? Part of your assignments in the first 2 weeks was to peruse through Healthy People 2030 and see what they're all about.
I think that's number 1. It provides a framework to improve the health of all Americans.
Does
I chose
everybody,
number 1 too.
does
That's what I
everybody,
Yes.
does anybody else have a different answer besides number 1? Number 1 is the correct answer. Okay. Number 3. Oh, before I forget, I'll do it at question 4. Number 3, which is true regarding uninsured and underinsured individuals?
3.
Is it
I
3?
chose C
3.
or 3.
Everybody with 3?
Yeah.
Why?
It's because they aren't going to the doctor to prevent that or get it treated early.
Mm-hmm.
Yeah,
They
because
can't afford it.
exactly, lack of access. Right? Great. So number 4, this is a select all that apply. So for all of you that got, say, a 1 right or 2 right, or whatever, there's no partial credit. So I had to, for some of you, I had to go back in and take, if it was 8.33, I had to take the 0.33 points out and give a 0. So your 8.33 went to an 8. Your 6.33 went to a 6. And I don't know, I don't know why this is set up that way. I have it on my list to talk to the curriculum team about. It should be all or none. Okay, so what are they? What are
B,
vulnerable
C, and D.
populations?
B, C, D.
Yes. B,
Okay.
C, D.
Why isn't A
Because she's 26, she's not a teen.
correct? Excellent. Good. Does anybody have any questions about that? Veterans are vulnerable populations, substance abusers are vulnerable populations, and clients with HIV are vulnerable populations. Okay, and the reason why A isn't is because we consider teen pregnancy a vulnerable population. Okay, and this isn't a teen. Excellent. Which statement reflects the term resiliency as it refers to vulnerability?
A.
I chose A.
Okay, anybody choose anything else? A is the correct answer. Do we all understand why A is the correct answer?
Yes.
Okay. Number 6. Which child, a lot of you got this one wrong. Which child should the school nurse care for first? This is a priority question. So when we think priority, what are we thinking?
B.
Airway.
And we're thinking
The
ABCs.
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 I put the ABC so it's B, the coughing, unable to participate in physical exercise.
Yeah.
Okay.
That's what I put.
Anybody else want to take a stab at it? B is the correct answer. Why? What is that a sign of?
Asthma. He can't breathe.
Asthma attack.
Yeah.
That's impending asthma attack. And because we're thinking ABCs, okay, this is a ABC answer. Okay, because if we go into a full-blown asthma attack, well, we're going to be doing our ABCs, right? Okay, good job. Okay. Answer?
Eggs.
I put A.
A.
I put
Eggs.
eggs.
Why? Eggs is the correct answer. Why?
Eggs are higher in iron than bananas, and white rice. It would be whole grain, wouldn't it? So white rice isn't it either?
Okay, yep, eggs is the correct answer. Good job. Okay.
I
8,
picked B for question 8.
picked B.
I chose
Okay,
B as well.
okay,
I chose B.
okay. B is the correct answer. What are we thinking here? What might be going on? What is a dark discoloration along the neck crease and armpits of a child? What is it?
Food
Insulin
hygiene is
resistance. So we'd be worried about type 2 diabetes.
Exactly.
Mhm.
Yep, great. Number 9, which nursing intervention is a priority for a child experiencing developmental delay? We went through this last week.
The lead exposure.
Yeah, the lead exposure.
Everybody understand why? Because we talked about lead exposure potentially leading to developmental delays, right? And number 10.
Professor, go back to the question number 9, because I have a question. Because it says nursing intervention. So I'm assuming nursing intervention is when you intervene.
Part
And
of the
I didn't
part-
choose evaluate environment. I chose assess the lungs because that's something that I will be doing. Maybe I got confused. I'm
Yep.
just
part of an intervention is evaluation, right?
mhm. Okay.
Well, you have to evaluate before you go ahead and start listening.
Decide what your intervention is, right?
All right. Okay.
Fair?
Fair. And I got it wrong.
Okay, number 10.
The
I
C.
chose C.
Why?
It's
Because
obesity,
they're
isn't
not.
it?
Yeah.
That's right.
Not
That's
active
correct.
there.
Why is D wrong?
Because they tell
You're
you
not supposed to give fruit
give the
juice.
juice.
Say that again.
They don't want you to give the juice.
It's full of sugar. Full of sugar and calories. Okay. So does that help going through it?
Yes.
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 Will you make it to where we can see which questions we got wrong?
Yeah, I have it on my notes. I have my curriculum meeting on Wednesday, and I have starting a long list of things I need to address with them, and that is one of them, which is why we're giving partial credit for number 4. It should be 0 or 1. Got to get all 3 right or none. So that was because I have to go back and manually do those. And number 2, why you guys can't see what you got wrong. That seems crazy.
It's a setting.
Yeah,
The other classes where once we finish, we can see what we missed. So I think it's just a setting you have to change on whether you want the answers to be shown once we finish or just the score.
Okay.
I can't none of them from any of my classes.
You can't see any of the wrong answers?
No, they just
Okay.
all show answers. And that's how I felt like it was how am I supposed to know what I got wrong or what I
Right.
need to
I
can't-
agree. That's why I'm saying it's on my list to talk to curriculum about the curriculum team to find out, because, like NCLEX, I think that when you get answers wrong, you should be able to see the rationale, why what you picked was incorrect and why the correct answer is correct. So, and that's why the other thing too, so thank you for bringing that up. It's on my curriculum agenda to ask. The other thing too, now that I'm talking about wrong answers, NCLEX, when you get your NCLEX score, you get rationales for what you got wrong, correct?
Yes.
I probably said this in week 1. I am a huge believer in rationales. Okay, rationales, I believe, are an excellent resource for learning. So whenever you have the opportunity to read rationales, please do that. Right? There have been a couple of people that sent in their NCLEX and they got in the 30s. To me, that means that you didn't learn a lot if you got in the 30s. You got a lot of questions wrong. And so I have, for those students that got below a 40, I have sent them a message that says, I have reset your NCLEX for you to be able to do it again, if you would like. It's not mandatory. And you guys do know that you can do your NCLEX as many times as you want, right? And then submit your highest one. You guys know that, right? So
Yeah.
if I were you, I would be doing your NCLEX all the way up into the high 40s, even at 50, because that tells me that maybe you started out when you're on your first round, you got a 20 or 25, you did it again because you read the rationales. The next time you did it, you got a 35. If that's still not acceptable to you, then do it again. Do it again. But those rationales are key to learning. And the reason why we've chosen the categories that we have, it coincides with the learning for that week. So NCLEX, that's why we give you 4 sets of NCLEX questions. It's an awesome way to learn things as you're going. Does that make sense? So that's just my suggestion. I mean, if you turn in a 35, then you turn in a 35. I've reset it. If it's not resubmitted for a higher score, then it's up to you. I'm just telling you my philosophy of rationales. Always take advantage of rationales. Always. Okay. All right. Anybody have any questions? Let's get into our week 3. I'm going to pull up, I'm going to try and go back and forth. So in our notes, okay, we're going to start with rural and migrant health. So that means I'm going to go back and we're going to review migrant and rural. We're going to review these sheets. These sheets are these sheets in your, this is your learning this week. This is what you're supposed to be reading. Okay, so there's nothing in the book. Okay, this is your reading for this week. All right, so let's take a look at this. Has anybody read these yet? Okay.
No.
So a migratory agricultural worker is often called a migrant farm worker. Okay, so they're usually temporary employees. Okay, seasonal employees. Okay, it is difficult to determine the number of migrant seasonal agricultural workers. All right, estimates the number of United States estimates the number of migratory or migrants, seasonal workers, to be between 1 and 3 million. Right, which may be higher if you count all the dependents. Okay, so according to the National Center of Farm Workers Health, approximately 16% of migrant workers, or 16% are migrant workers, and 84% are seasonal. Okay, both these populations are predominantly Hispanic, Latino, right? And a large majority of these workers were born in Mexico. Okay. Other nationalities also include white, African American, Haitian, and Asian people. Okay. Another statistic, 68% of the agricultural farm workers are male, average age of 38. Okay. And then just under half of all farm workers, 49%, are in the US, are unauthorized workers. Okay. So what are some common, what would you think before we go through this? What would you think are some common health concerns specific to migrant farm workers and their families?
Polytuberculosis, hepatitis will be, I think, my number 1 thing.
Mm-hmm. Yeah. Yeah. So we have 7 bullets here. of some specific health concerns. Okay, so due to the physically demanding and intensive nature of their work, there's several health concerns that put farm workers and their families at risk. Heat-related illnesses are significant dangers to farm workers who spend hours and hours in the direct sunlight. Okay, heat-induced illnesses can be fatal, right? Exposure, this is a big one. This is the biggest one. Exposure to a variety of pesticides and toxic chemicals. Okay, these can have serious health consequences. Okay, and then injuries is a big risk. Okay, both with equipment and as well as tools. Urinary tract infections and other infections, right? Lack of toilet facilities available while on the job. And then bites, animal bites, right? And as Walter said, higher susceptibility to infectious diseases such as TB. Okay. Mental health issues is another big one, including depression, right? Influenced by the ongoing constant relocation, poverty and stress. A lot of these migrant workers are living in poverty. Okay, next section, what are some barriers that prevent rural migrant farm workers from receiving healthcare and healthcare coverage? So we know that migrant workers, farm workers have incredible barriers. Okay. Cost. If you're in a rural area, there's a shortage of healthcare services. Right, there may be a lack of culturally and linguistically appropriate services, lack of information about healthcare coverage options. It can be very confusing. Okay.
They also get scared because they don't go to the hospitals or nothing because they don't want to be deported and stuff. So they miss out on a lot of stuff.
Exactly. Right. Obviously, no sick leave, losing, like Walter just said, they will continue to work sick so that they do not lose their pay for the day. Social isolation and exclusion. Okay. And like Walter just said, for undocumented workers, fear of how their immigration status will affect their eligibility. Okay. So the frequent location creates challenges. Okay. Especially for the continuity of care. Okay. Let's say they have diabetes or cancer, or HIV, their constant relocation coupled with the lack of access also inhibits farm workers from seeking preventative care, primary care, annual checkups. Okay. So when they're diagnosed with something, it's usually at the later stages because they haven't sought out the primary evaluations. Okay. So that's about our migrant farm workers. Let's jump to rural and then we'll cover our notes with those two. So they kind of go together. Okay, rural populations. What's rural? What does rural mean?
Outside of the city,
Mhm.
like farmland. And
Those small towns.
Yep. Right. All right, we know that access to healthcare is critical to our overall health, no matter where you live, right? Rural residents also face a variety of barriers. Okay. So residents should be able to conveniently and confidently access services such as primary care, dental, behavioral, emergency, and public health. Okay, why? It's good for, this is in general, overall, physical, social, mental health status, disease prevention, detection, diagnosis, quality of life, avoiding preventable deaths and life expectancies. However, rural residents often encounter barriers that limit their ability to obtain the care they need. Okay, in order for rural residents to have sufficient access, right, it is necessary and appropriate healthcare services must be available. So what do we think happens in rural communities? Are there lots of specialties? Like, is there high risk OB, high risk neonatal?
I
There's
think
not.
that they have to travel long distances to get the care,
The
just
specialty
regular
care.
care, but then they have to travel more further out to get specialty care, like
Yep.
literally more distance.
And a lot of rural communities have a doctor, one doctor that may be the doctor for the entire span of the life, infant, pediatrician, a family doctor that cares for everybody. Okay. A lot of times in rural communities, medical staff is shared between several communities. So what are some barriers? Financial means to pay for the services, whether it be health or dental. Right? How do they get to the services? One of the big issues in rural healthcare is transportation. Okay, how do they get to their appointments if they need to seek specialty care? Can they get paid time off? Right? A lot of rural families lack the confidence in their ability to communicate with healthcare providers, right? The language barrier. Right. And that the other thing that's big in the rural community is the lack of anonymity. Okay. Rural communities are very tight knit. Everybody knows everything about everybody. And so a lot of times with the, let's say, domestic violence, abuse cases, sexual abuse, people don't come forward because they're afraid that it's going to get out to everybody in the community, right? So there's a lack of trust that they can use the services and still and have it kept private. Okay, and a lot of rural people, clients, don't necessarily believe that they will receive the highest quality of care. Okay, so access is a big deal. Okay, and barriers are a really big deal. Okay, transportation, we talked about, shortage of staff, health literacy. What's the difference between health literacy and health illiteracy? Okay, they don't understand what you're talking about. There may be, rural clients are made up of many, many cultures. Does that nurse that works in the rural community understand different cultures, understand their values and beliefs and practices? Okay, so these are things we need to think about. We know that rural populations have more limited access to primary care physicians than residents do in the urban areas. We know that rural clients are typically older, sicker, and poorer than their urban counterparts. All right, we touched upon it briefly, but travel to reach these primary care providers or even specialty may be burdensome, is a barrier in itself if you live in remote rural areas. Okay. So barriers to healthcare result in unmet healthcare needs, including lack of preventative and screening services and treatment of illnesses. So, like I said, a lot of these rural clients are finally diagnosed in late stages of illnesses. Okay. So, and we know that for rural residents facing access issues, that certainly contributes to the health disparities. Okay. So the barriers, distance and transportation, workforce shortages. Look at that map. Health professional shortage areas in primary care. That's a lot of blue. Health insurance coverage is another barrier. And you guys are going to have to go back and read through these sections that I'm going through, but health insurance is a barrier. Internet, broadband access. Okay. Poor health literacy, that's your language barrier. Social stigma and privacy issues, we talked about that. The lack of privacy, the lack of anonymity. And then why is primary care access so important for rural residents, right? We know that just in general, primary care is the most basic, and along with emergency public health services, the most vital services needed in rural communities. Okay, primary care providers offer a broad range of services and treat a wide spectrum of medical issues. Okay, a lot of rural communities lack primary care. Okay, and you can read about that. So what types of healthcare services are frequently difficult to access in rural areas? Home health. Why? It gives you a list of why it's hard. Reimbursement, face-to-face requirement, homebound, the ongoing changes in rules and regs, your workforce, shortages in workforce, right? Time and resources required to travel up into these rural areas. Okay. And then how about hospice and palliative care? Okay, that's also a big area that faces many barriers and challenges. Kind of the same thing, workforce shortages, recruitment and retention, reimbursement, limited access to broadband. And I talk about this in my RN class that, you know, let's say you're the nurse, you're the rural nurse, and you're, you might be wearing all the hats. You might be the counselor, the educator, the pediatric nurse, the labor and delivery nurse, the discharge planner. I mean, I've said before, in community nursing, you have to bring your whole toolbox, right? Your med surg, your peds, your OB, your all your skills. But think about if you're a rural nurse, okay? That even requires a bigger toolbox, right? It may be everything, anything and everything could be thrown at you. Okay, and one of the biggest barriers in rural care is mental health. Okay, access to mental health providers is a huge challenge in rural areas, which is kind of sad because mental health issues are very, very prominent, very common in rural areas. Right, so often it's the primary care that are trying to fill in the gap. Okay, March 2021, 58% of mental health professional shortage areas were located in rural areas. That's a lot. Okay, that's a lot. Okay. And then another big issue in rural health is substance abuse. Okay, huge issue, whether it be drugs or alcohol. Okay, and you can read through that section. Then OB and maternal health services. Okay, if things are going well and it's kind of a normal, healthy pregnancy, you know, maybe there's not an OB in the area, you may have to travel to get your OB services, or can a primary care handle your visits, your prenatal visits? Excuse me. Right, so 2019, access to rural maternity care states that there's it's a decline in access to maternity care in rural areas, and factors just contributing to the decline of access. Okay, and then dental, oral health services. Excuse me. Right, we know that oral health can affect overall physical and emotional health. Okay, traditionally health insurance don't cover oral health services. So think about the rural community. Okay, the lack of access to providers in a rural community. And again, the same study, March 21, 63% of dental shortage areas were located, dental shortage staff were located in rural areas, 63%. Okay. And then how do rural healthcare facilities and service closures impact the access to care? Okay, they've got to drive further. Okay, are there alternative services that can fill in the gap? Do they even have transportation? And what if they're living in poverty? Do they even have, what's their socioeconomic and health status? Okay, so I want you to have a read through that. Okay, what are some strategies to improve access? Okay, whenever you read through that, but some of those strategies are delivery models. Okay, some good, really good suggestions in there. Affiliation with larger systems and networks that can maybe get people out into the rural communities. You know, the bigger networks in the closest cities. Develop networks to go into the rural areas. And obviously recruiting. Always trying to find people to fill in vacancies for healthcare staff. Telehealth is huge now. It's always been there, but due to the pandemic, telehealth became huge. Anybody done any telehealth visits with their doctors since the pandemic hit? I have. I've done it, several of them. Anybody else?
I have.
Yeah, yeah.
Yes. I
Really
have.
popular. And then what about rural veterans? Okay. A lot of them need services that are at a VA facility. And there's not any VA facilities in rural America. You have to travel. Okay. What is different about healthcare access for American Indians, Alaska Natives, and Native Hawaiians? So have a look at that section. So I'm just asking you to review these sections. And then here's a super list of organizations who work to improve rural healthcare access. And a few foundations that are already working to fill the gap with reimbursement issues. Okay. So I want to go to our notes and cover those two areas. We've probably already covered a lot of it. Okay. Rural and migrant health. It's together in your notes. Okay. So we talked about this a little bit. What is rural living? Could be a remote farm, village, small town. So in the past decade, it's seen population shift from urban to less populated to rural. A lot of people are moving out of the cities, going into rural areas. Okay. What are some vulnerabilities in the rural areas, right? They tend to have a higher proportion of residents who are younger than 18 and older than 65. They tend to be less educated. And this is interesting, more than 25% of Americans living in rural America are either live near or live at the poverty line or near the poverty line. 40% of rural kids are impoverished. Most at-risk are children, racial and ethnic minorities, and single-parent families, especially single-parent families with a female as the head of the household. I've already talked about fewer residents have insurance or adequate insurance. Okay. Then this is big. Rural adults are less likely to prioritize their health and engage in preventative activities. They're more likely to smoke, drink alcohol, be obese, and they're less likely to engage in their screening and wellness visits. right? Which leads to the next. They're much more likely to have chronic illnesses, heart disease, COPD, hypertension, right? And here's an incredible statistic. 50% of rural adults have been diagnosed with at least one of these chronic conditions, all right, as opposed to 25% of the non-rural adults. Why? Because they're not seeking out preventative, really prevention, primary or secondary measures. They're not seeking out prevention like wellness visits and primary care visits, and they're not seeking out screenings as well. So we know that rural health adults tend to have poorer health, and they're less likely to seek medical care. We talked about when they get sick, they may have transportation issues. They may not be able to get various services due to the proximity. And then another statistic, rural populations have higher infant and maternal morbidity rates, especially in areas with very poor physician coverage. As we talked about, they lack specialty areas, pediatrics or OB specialists. Mental health, higher rates of persistent depression, right? Poverty is a big deal, very common in rural areas. Okay, and here there's four primary high-risk industries in rural areas. Okay, we need to know these: forestry, mining, marine-related fields, and agriculture. And you can read through why these four are high risk. Okay, so I'm just gonna highlight this. So read through that. We talked about this a little bit. I don't know why I haven't been highlighting, but farm workers, the health risks, pesticide exposure, we went through all these. There's a few more, but pesticide exposure is the key. Number one risk. Okay. And then kids living on the farms have similar health risks. Okay, and we give you in your notes is what is a pesticide exposure. Okay, so I'm going to highlight this whole thing. You need to know that. Okay, so there's a summary on your rural and migrant health, right? And then let's go to migrant farm workers. We've already gone through most of this. I'm moving around a lot. Language barriers, we talked about that. Here's something interesting, right? Female migrant workers have a high risk of sexual harassment or abuse. Okay, and then here's kids, migrant kids, dangers of kids working on the farm. Same as adults, but children working on the farm with the parents should try and perform short, simple tasks out of the sun, get them out of the sun, avoid them working with any chemicals. Okay. And then interesting, our food supply in the US would likely collapse without the work done by migrant farm workers. Okay. They're kind of the unseen part of our society. 2 to 3 million work seasonally to get food to the market. Okay, they don't receive anything. They receive a salary, but they don't receive workers' comp, disability benefits, any kind of health benefits or retirement benefits. And you can read about the housing issues. Often their accommodations are far from good. They're typically substandard. Okay. Migrants are at high risk for diabetes, poor dental health, obesity, and depression. Migrant workers in rural clients have a lot of the same risks, but there are some differences. Okay, this Migrant Healthcare Act provides primary and supplemental health services for migrant workers at outreach clinics. However, why don't they use that? Why don't they use those services? Because if they're undocumented, right, they're afraid that immigration services might get involved. Okay. I'm just organizing as we go. Okay, do we have any questions about rural and migrant? Anybody? Okay, let's talk about, go back to the, let's talk about, sorry. Talk about poverty and homelessness. I've asked this before, but what is the leading indicator of the health of an individual, a family, or a community? What's the leading indicator? Easy answer. Go ahead. Somebody who's going to talk. It's the financial stability of the client. Okay. Okay, what do we know about homelessness? It affects everybody, correct? Would everybody agree with that? Affects everybody, men, women, children of all races and ethnicities. On any given night, more than 610,000 people in the United States are homeless. And a little more than 1/3 of these are families. Saw a lot of homeless families when I was in the schools for 20 years, and it really exacerbated and increased over the past 2 years with the pandemic, when parents lost their jobs. Very, very sad, right? And we know that homeless people are more likely to become ill, right? Have greater hospitalization rates, and have a shorter lifespan. Okay, the average lifespan for a homeless person is between 42 and 52 years. It's incredible. Homeless kids are very much at risk. Okay, they're sicker and they have school issues. I saw this over and over again in the schools. So the insufficient personal income or living in poverty, lack of affordable housing are the major issues of homelessness. Remember that insufficient personal income and the lack of affordable housing are major issues. Advanced medical problems, psychiatric illnesses that may be exacerbated by abuse, substance abuse, drug, alcohol, combined with economic, social issues, poverty, right? Make this population, the homeless population, a huge challenge for the healthcare system, okay? And their local communities, okay? So there's a multidisciplinary healthcare team, okay, that is trying to focus on the homeless. It starts local, state, federal, right? They're trying to ensure that homeless get quality of care, to try and help these homeless clients be self-sufficient, help them succeed. Okay. What's the definition of homeless? Individuals without permanent housing who may live on the streets, may stay in a shelter or a mission or a single room facility, vehicle. Okay. So people may be considered homeless if circumstances force them to stay with a series of friends or extended family members. We saw a lot of this in the schools, staying with relatives. Or if they've been released from prison or the hospital and don't have stable housing. So you can go through and read the demographics. Very interesting. Risk factors. Okay. Chronic illnesses are very prevalent with homeless clients. Substance abuse, mental illness, and early death. Okay, so compared to the general US population, homeless people are 3 to 6 times more likely to become ill. Their hospitalization rates are 4 times higher. And they're 3 to 4 times more likely to die at an early age. Okay. Disability is often the result of these medical and psychiatric conditions. Barrier to employment perpetuates the cycle of homelessness. Okay. Homelessness, huge impacts, negative impacts on kids. Right? If you think about it, think of, we had lots of families that were homeless and they had kids of all ages. Each of these kids are affected in different ways, depending on their developmental, where they are at developmentally. Okay. Homeless kids are sick 4 times more often than children who are not homeless. And they're very, very prone to asthma, iron deficiency, lead poisoning, respiratory, ear infections, GI issues, and certainly emotional and behavioral problems. Think about what they're going through. Right? They're also at risk for delayed development, stunted growth, twice the expected rate of learning disabilities. Right? They potentially are experiencing hunger, abuse, neglect. Okay, poor nutrition. How do we assess or approach or engage with a homeless client? Has anybody ever in their employment histories ever engaged with homeless populations? Anyone? I can only see a couple of people because I'm sharing my screen.
No.
Has anybody engaged with homeless clients?
We do at our hospital, especially families with no homes and they have kids, so they have to. I've seen a lot of them.
Yeah, really sad. Really, really, really sad. So this initial approach goes to how do we engage with a homeless person or family, right? It's about establishing trust. That's what it comes down to. Okay, establishing trust, compassion, kindness, empathy, non-judgmental. Most people don't want to be homeless. Okay. So the initial goal is to address the medical issues that might be going on. Okay. And here, establish confidence and mutual trust. Encourage the patient to go to the doctor's office, right? Once your trust and rapport is established, then maybe you can visit and focus on identifying an emergency contact. Maybe identifying their more challenging social medical needs or end-of-life issues. Okay. Trying to help them make referrals or making referrals for them, helping to schedule follow-up appointments. Right? How to, if they've gone to the hospital and have lab tests, how do we follow up on that? This is usually where a patient advocate, a case manager might come in to start to coordinate the care. Okay, setting short-term goals, long-term goals, but it's all about whether the homeless individual family wants to participate, wants to engage and participate. A lot of them don't. Okay. The homeless people tend to have the same medical conditions as the general population. Right? The big difference is that the homeless experience long-term exposure to disease agents, okay, such as infectious diseases, overcrowding, unsanitary conditions, poor nutrition, sleep deprivation, and on. Limited education, mental illness, substance abuse, and distrust can affect their ability to engage with you or to contract with you or to come up with a common plan for them. Okay, because of this is really important. Homeless people tend to present with advanced diseases. Okay, and the approach to therapy is different depending on each person's situation. Okay, then it goes through some clinical and medical conditions that are prevalent. You can read through these. Cardiovascular disease. What about if they have a dual diagnosis, mental illness and substance abuse? Cognitive disorders, TBI is very common. And then injuries and violence, domestic violence, rape, physical assaults occur regularly within the homeless population for a variety of reasons. Okay, so I want you to read through that. Preventative health issues, infectious disease issues, sexually transmitted infection issues. Okay, they're all part of the homeless, all part of the risks of a homeless population. Skin and foot problems, exposure-related conditions, cold. I mean, would you know how to assess them for frostbite, cold exposure, heat exposure? Okay, what's a good model for caring for the homeless? Okay, it involves a team approach, integrated multidisciplinary approach by a team of healthcare professionals that's knowledgeable about the challenges faced by homeless people. Okay. They know what services are available. I mean, we're not really, primary is kind of out the window, but secondary screening and tertiary, they're already going to have, remember, they already have the issue. So you're mostly providing secondary and tertiary care, maybe even respite care, end of life care. Okay. Let's go to our next page because we're doing these together. So homelessness and poverty. And then we'll review the notes in this section. Okay. I know it's really a sad subject to talk about the homeless, but if you're in community nursing and public health nursing, that's part of it's part of your clientele. Okay. And the other big part of your community is poverty. Okay, you're going to be working with lots and lots of individuals and families that live in poverty. Okay. So according to the most recent estimates from 2019, non-metro, so outside the cities, poverty rate was 15%. Okay, compared to 12% in the metro areas. And this just goes through a bunch of statistics. You can read through that. What's the geography of poverty? Okay, poverty tends to be clustered in certain regions, counties, and neighborhoods, rather than being spread across the nation. Right? Research has shown that poor living in areas where poverty is prevalent creates increased risks for health issues, right? Concentrated poverty contributes to poor housing, health conditions, higher crime rate, school dropout, and unemployment. Right? So economic conditions in very poor areas create limited opportunities for poor residents, right? And it becomes self-perpetuating, generational, they call it generational poverty. Look at some of these visuals, some of these tables. Okay. Here's a table of poverty demographics, which you can take a look at. And breaking down by race and ethnicity. So they're talking about poverty within families. Okay, families headed by families that have 2 adults versus single families, and the difference in poverty rates. Difference in poverty rates in metro areas and non-metro areas. How do you define poverty? All right, so it's poverty is defined income below the federally determined poverty threshold. And here's some statistics in the second paragraph. Okay. So I would have a read through that. This is technically your reading for the week. So let's go cover here, poverty and homelessness. Okay. Okay, so such a bummer. Before COVID, the percentage of Americans living in poverty was the lowest it had been since the 1959. It was at 10.5%. Okay, after COVID, it climbed to 17.3. 48 million Americans. And child poverty being at 21.4%, 5 million kids. And I can tell you from my experience in school nursing, because I became an instant COVID nurse for 2 years, these statistics were absolutely correct. With so many people, remember how many people lost their jobs? Remember how many people had to quit their jobs because kids were remote and parents had to stay home and be with their kids, teach their kids, right? So poor or poverty really means having insufficient resources to meet family needs. And family needs that are priority, they're considered food, shelter, transportation, and healthcare. Okay, what are some contributing factors to poverty? Unemployment, loss of retirement benefits when a company closes or files for bankruptcy and their employees lose retirement, increase in female head households, inadequate education, job training, weak enforcement of child support statutes in states, outsourcing of American jobs, and then the increase in number of kids born to single women, particularly young women. What are some of the ill effects of poverty? Chronic stress, mental illness, chronic illness, higher infant mortality, morbidity and mortality, shorter life expectancy, more complex health problems, right? Lack of access, no primary care, no preventative visits. So more complex health problems because when they're finally diagnosed, it's more advanced. And then definitely an increase in disability related to chronic illnesses because I've had the chronic illness for quite a while and it just hasn't been treated, which then turns into much higher rates of hospitalizations. Okay, so complex health problems we know lead to high healthcare expenditures, which lead to a much more difficult financial life, often leads to bankruptcy. Okay, the inability to pay for healthcare, lack of insurance, living in areas where healthcare is unavailable, being able to, this goes back to more rural, but being able to afford to take work and take time off from work to travel may not be an option. Low-paying jobs typically do not provide health insurance. Poverty with regards to women of childbearing age suffer greatly. Diabetes, hypertension, obesity, asthma, HIV, STDs. All this can lead to pregnancy complications. And then the young kids. Okay, this is a good statistic for you guys to know. Younger children are at the highest risk for the effects of poverty. You need to know that. And what might you see? Poor nutrition, poor brain development, exposure to environmental toxins, depending on their environment they're living in, trauma, abuse, and just a general overall lower quality daily care. And the kids have more chronic diseases, more nutritional deficiencies, more growth and development issues, developmental delays, maybe higher lead levels, more infections. And then same with teens in poverty, more likely to have below average academic skills, and they're 3 times more likely to drop out of school. Okay, higher rates of teen pregnancy and more likely to suffer complications with the pregnancy, right? Lack of prenatal care. A lot of times they don't even want to recognize that they're pregnant. So they're not going to go to their prenatal appointments, which may lead to low birth weight babies, preemies, and babies with birth defects if they're, have substance abuse issues during the pregnancy. Okay. Jumping back to homelessness. Okay. What might lead to homelessness? We've already kind of covered this, but unemployment, layoffs, downsizing. We saw this a lot during the pandemic. Without a regular income, how can they keep their home? And can they even afford to rent in the area? Right? They've lost their access to healthcare. They don't have a job. And what kinds of health issues? Acute or chronic issues, acute and chronic conditions, mental illness. Without a strong social support resources, homelessness may be on the horizon. We've already seen a huge increase in homelessness, individuals and families. That's already happening. All right, and then we talked about substance abuse, domestic violence. We talked about this. Homeless includes those in the street, but also for staying with friends, relatives, shelters. We touched on this a little bit. Exposed to the elements. Crowded and unsanitary living conditions. TB, skin infestations, chronic illnesses, victims of crime. Right? Trauma is a major cause of death and disability, such as gunshot wounds, stab wounds, head trauma, suicide attempts, fractures. Right? We touched on this as in your pages in the module. Right? As nurses, we have to respect the individuality of every person. Right? Many factors can contribute. And many of us are only 1 or 2 paychecks away from being unable to maintain our housing. Right? It's super easy to stereotype. But, who are we to stereotype? Okay? If we're stereotyping and being judgmental, we're risking our chances of developing a trusting relationship with that homeless family or that homeless individual. Hopefully we're not making assumptions. Let them tell their story. How did they get there? Okay, and then here's a good example of, or a good some good examples of primary, secondary, and prevention, and tertiary prevention. Okay, and this is in general. Okay, so primary, for the topics we've covered today, teach ways to avoid pesticide exposure on the farm. Everybody understand why that's primary? Preventative. Advocate for childhood immunizations in migrant farm worker kids. Again, primary, it's prevention. Advocate for better living conditions of rural migrant farm workers. Okay, maybe hopefully this reduces their risk of TB. That's all preventative. Okay, what about secondary? Secondary is what? Screening, right? Early identification, early intervention. Okay, what are we screening for? Screening for evidence of financial instability, especially those with chronic health conditions. What kinds of screening could we do? Yearly blood pressure checks, A1C levels, BMIs. Educating them on the importance of scheduling screenings like cancer screenings, pap smears, colonoscopies, mammography. Right, so that's screening, right? Early identification. That's what secondary is all about. And then tertiary, they already have the illness or the disease, right? So then we're providing guidance on maybe non-pharmacological management of lower back pain. Okay, so their condition is lower back pain. Helping a homeless client find resources. They're already homeless, so we're working with them to find resources. Referring to the health department for treatment of STDs or HIV. They already have STDs or HIV, and we're trying to help them manage that by referring them to the health department. Teaching a client how to take their medications. Okay, they already have a condition that is requiring them to take medications. Okay. So do we understand why those are primary, secondary, and tertiary?
Yes.
Is that helpful?
Yes.
Okay. So we've covered 4 things today. We've covered, there's 4 pages in your module: migrant, rural, homelessness, and poverty. And then that is broken out in your notes. And you can see that a lot of the dots are connected. There's a lot of the same information is in both places, but that's what you're expected to know for this week. Okay. Too much information, too little information. Was it organized? I think it came together pretty well. What do you guys think?
Yeah, it was a lot of information, but it was organized really well, I feel.
Yeah, these are hard topics. These are hard topics. So many people living in poverty, families in poverty, kids that are homeless, families that are homeless, and the challenges of the rural population and migrant farm workers. But this is what community nursing is all about. That's why I always like to ask at the beginning, you know, what do you think community nursing is all about? It's not just home health visits, you know, it's not just hospice care. Most of what you're working with is vulnerable populations in the community. So some of this is tough stuff. I always marvel at the staff that work with homeless populations in the shelters, on the streets. I marvel at them. That's their calling. That's what they want to do. But we got to, as nurses, we have to check our, what am I trying to say? Check our personal feelings and check them at the door. These are people too that have either maybe just run into hard times but that's what we do as community nurses and public health nurses. We work with vulnerable populations. So anybody have any questions?
The quiz this week is on this material today. Okay.
And we won't go through it next week because it's exam week, but maybe in week 5, because I think this is let's see, I think we had 2 quizzes, so it was last week and this week. And I think we have a break. Let's look. I think we have a break. So this is week 3, you have a quiz. Yeah, so there's no quiz next week. We skip it, and then there's a quiz on week 5. So when we get to week 5, I mean, I could put it in the recording, but I'd rather do it with you guys. Rather do it with you guys live. So we'll review quiz 2 in week 5. And in the meantime, I hope I'll get some answers as to why you guys don't get to see what you got wrong, and there should be rationales for why it was right and why it was wrong. So I'll work on that. Okay, so if anybody didn't put their name in the chat, I need you to put your name in the chat. And let's all pull up our week 3 attestation, please. Let's get that done now so you don't have to worry about it. And there were some stragglers for last week who didn't get it in. You had all the way till Sunday to, well, you're supposed to do it within 24 hours, but even as of this morning, I had to send out some reminders of you got to do your attestation. And that was from a week ago Monday. So it's supposed to be done within 24 hours of your class. Otherwise, you're supposed to get a 0, which means you don't get credit for attendance. That's why I like to try and do this at the beginning of every class, at the end of every class, so I know it gets done. So it's simply Marvel 25th. Anybody have any questions? How about 20 minutes and the gift of time? That help? I know you're back to back with classes. So we've covered all the material we need to cover for this week. I'm going to get working on study guide, or keep working on my study guide, and hopefully by the end of the day, I'm just waiting to hear about one commitment I have on Friday, just to confirm that before I do a schedule a review session. Do you guys have class on Fridays?
We have clinicals. The Orange Park campus, we have clinicals on Fridays.
Okay. I'll make sure I'll record the reviews, send them out to everybody. Okay.
Okay.
Was that your question?
No, I was just gonna say we don't, well, the one in Port St. Lucie, we don't have clinicals on Friday.
Okay. I have to teach 2 classes this Friday, so I'm going to probably have to do it probably in the afternoon. Okay. Okay, I'm done. If everybody's hit submit, right? Everybody's hit submit. Okay,
Yes.
so you don't have to worry about it. It was really nice to see everybody today. It's Monday. I hope you guys have a great week, and reach out if you need anything. Okay, check your announcements this week. Study guide, review sessions, exams ready to download. We went through vulnerable populations assignment. Oh, you should be getting, and the other one is groups. You'll get an email from me about groups, and per your request, we'll try and keep the groups within the same campuses to help you guys out.
Okay, thank you. Have a great day.
All right, talk to you later. If anybody has any questions, I'll stay on. Juliana, stay on for a minute, please. Who else did I need to stay on? Joanna. Teresa, we already solved your problem. You don't have it yet. Right? Okay. Juliana, are you in this class? Are you in this class?
Yes. Yes, I am.
Yeah, I don't have you in this class. I have you in another class. Hang tight.
Okay.
Yeah, I have you in. I have you in my Friday class. I think. Let's see. Wait a sec. Just hang tight.
Okay.
Do you go by another last name?
Yes, Juliana Godspower Odion.
What's the last one?
Odiong.
Oh, Juliana.
Yes,
Stay,
ma'am.
you're in my tonight's class.
Yes.
Okay, well, it's not till 8 p.m. tonight.
Oh, 8 p.m. Okay, I'm sorry. I'm actually out of the country, so I'm having the times mixed up. I'm in a different time zone.
Okay, okay. I do, tonight though, stay on after. I want to talk to you tonight.
Okay.
Okay?
So come log out and come back or stay.
Hey, you could stay for a minute. Sure. Stay here. Just stay point.
Okay.
Teresa, do you have a question? Teresa, do you have a question? I can't hear you if you do. Teresa, I can't hear you. Do you want to send me an email? Okay, bye-bye. Joanna, quick question. Last week, were you in class? I didn't have you in week 2.
Hi, Professor. No, I wasn't. I had a family emergency with my mom.
Okay. I'm sorry. Is everything okay?
Yeah, she's feeling a little better.
Okay. Just let me know. Okay.
Yeah. No, I'm actually going through all my emails now, and I see that you sent me an email, and I haven't even responded.
Okay. Just please watch the recording.
Okay.
Please watch the recording from week 2.
Okay. And then where do I put the date for when I finish watching the recording?
Just put, when you go to do your attestation, just put in whatever, 725 watched recording from week 2 per Professor Marvel.
All right.
All right.
Okay.
Good luck with your family emergency.
Thank you so much.
Bye-bye. Bye. Okay, Juliana.
Yes, ma'am.
I have, hang on. I'm all over the place with your attendance. I can't figure it out.
Yes.
I have.
Yes. So I just had a baby on the 12th of July. The baby just turned a week plus.
Okay. Congratulations.
And I'm out of the thank you. It's my son. So I'm just still, coming out of it right now.
Okay.
Today is the proper day that I'm joining. I've always been listening to the recordings.
Okay. All right. So you've been listening
but
to
I'm
the
ready for the
recordings.
quiz. I'm ready for the quiz. I've been studying, as much as I can. I'm actually ready for the quiz.
You mean for the test tonight?
The test today, I meant to say.
Okay. Listen. Okay. So you are. Okay. All right. That helps. All right. So what's the time difference?
Right now it is.
What time is it for you?
It is 9:45 p.m.
Okay. So do you know what time you're going to sign on? It's 8 o'clock, 7 o'clock Central. So I'm in Central Time. So for me, it will be, hang on, let's see if we can figure this out. Classes from 7 to 9.
So that would be around.
So we're 6 hours apart.
Yes, 6
right?
hours apart.
So you need to sign on 7 o'clock, 1 o'clock in the morning.
Okay. So I will sign on, you said 1 o'clock or 12 midnight?
1 a.m. If
Okay.
if you're at 9:46 right now, I'm at 3:46. So we're 6 hours apart.
Okay.
So if the exam starts at 7 Central Time, 6 hours is 1 a.m.
Okay. So that's gonna be, okay.
Right? And then come on a little bit early.
Okay, is it the same link that I clicked on?
Same link. Yep. Where are you?
I'm in Nigeria, in Africa, West Africa.
Awesome. Okay. Congratulations on your baby.
Thank you. He is a crying baby and he just got circumcised. So I
Ooh.
just, so I can imagine. I don't even sleep. Like I'm just holding him all day. He wants to be held. Hold on, let me get him so you